Okay. Hi, Jillian. My name is Richie. I'll be interviewing you today for an FMP position, family nurse practitioner. I'm gonna ask you a few questions, basic interview questions, and then you answer it to the best of your knowledge. Okay.
Okay, great. Thank you so much, Richard. It's nice to meet you. Thanks for having me today.
Likewise. Thank you. So the first question is, why did you choose this career track?
Well, I've worked in healthcare for about 10 years now, and I initially started out as a medical assistant working with some nurse practitioners. And I was able to see firsthand the care that they were able to provide to patients and just how wonderful they were. And I appreciated their level of autonomy that they were able to provide and be an independent provider just by themselves. And so when I started exploring this path and started initially working as a nurse, I found myself enjoying roles where I was definitely serving patients almost more in a one on one kind of environment. And so I felt like going the nurse practitioner route was definitely a step in the right direction and the next step I should take. And the family nurse practitioner route interested me because I felt like it was the most broad choice for myself moving forward and the many interests I currently have in nursing.
Thanks. That's very good. So the next question is, what college subjects or jobs did you like best and like least, and why?
Well, in college, I suppose I really liked the biological sciences and many of the courses that I took in biology, anatomy and physiology, just about the human body. It's very interesting and very complex. So I definitely enjoyed that class in school. In terms of nursing courses, I liked many of those as well in my program. I enjoyed our community health program and working out in the community. I enjoyed a lot of our theory courses and just learning about the background about nursing and how it became what it is today, and learning about really important women in the nursing field, including Florence Nightingale. So those would be some of the classes I enjoyed. In terms of some of the positions I've thoroughly enjoyed as well. In the last few years, I've actually worked as a PACU nurse and also in an OR setting. And again, as I previously mentioned, I really enjoy that one on one environment working with patients. So I've really enjoyed the PACU roles I've done in the last couple of years because typically I'm able to work with patients one on one during their recovery. So I've really enjoyed those roles.
Cool. That's nice.
Thank you.
Tell me a little bit about yourself.
Well, I'm from Washington State on the West Coast, and I went to Washington State University for my undergraduate degree and started off in biology. I think I wasn't initially sure that I wanted to be a nurse coming from a family with no one in healthcare, so didn't really have that firsthand exposure. And so I kind of discovered this field a little bit more on my own. And so I worked as a medical assistant for about 6 years before going to nursing school. Initially, before applying to nursing school, I thought I wanted to go to medical school and then thought about the physician assistant route, but started to explore nurse practitioner programs and nursing a lot more and felt that that was actually a better route for me to take. Basically, following the holistic approach to care and really feeling like that really fit my method of wanting to treat patients much more than the medical route. So then I went to DePaul University for my nursing degree and earned my master's initially. I wish I had been a nurse practitioner program, but that's now what led me to the current program I'm in at Regis College. And so I've been a nurse for the last 3 years, and I've actually worked in a variety of settings, including a medical surgical unit at a hospital and an ICU. I've also worked in home health. I've also been a substitute school nurse. And more recently, in the last couple of years, I've worked in the operating room and post anesthesia care unit. So really enjoyed that as well.
Cool.
It's a little bit about me.
You have wide experience in
Thank
the
you.
nursing field.
Yeah, kind of dabbled into everything, it sounds like.
Yeah, that's great. Okay, so what is one of your greatest strengths and weaknesses?
I would say one of my greatest strengths is that I'm definitely a compassionate, caring person. I really try to give my full attention to any patient that I'm working with and always really feel like I put the patient first. And I'm definitely a patient advocate. regardless of what's happening with that patient. I always want to make sure that no harm is done by them and that they are getting the best experience possible. So I would say that I'm definitely compassionate in that sense, and always care about any patient, regardless of their situation or status or what they're coming in for treatment. In terms of one of my biggest weaknesses, I would say that I tend to be a little bit not too organized, but I can be very detail oriented. And what I mean by that is, I think sometimes I can get caught up in trying to be as detailed as possible and really thorough and take my time. And sometimes I get caught up in taking too much time with documentation or working with patients. So time management is always something we can work on as individuals. And so I'd say, in relation to that, time management is something I think I always work on improving as well. So I would say that's probably a weakness.
Yeah, I wouldn't call that a weakness. That's actually good in the nursing field.
Well, thank you.
Okay, which 2 or 3 accomplishments have given you the most satisfaction?
I would say that actually getting initially into nursing school was definitely a big accomplishment. When I was originally applying to schools, my undergraduate degree was the GPA was not as high as it should have been. I think I enjoyed myself, to a great degree in my undergraduate career in education, but should have worked a little bit harder in terms of my grades. And so I think that definitely prohibited me from getting into school earlier or into different programs. And so when I found out I was getting into nursing school, in particular, a graduate level nursing program, I felt like that was a huge accomplishment. And I was very proud of myself for getting to that point. And then, actually, at the end of nursing school, I would say passing my boards, my licensing exam, the NCLEX on the first round with 75 questions, I think was also another big accomplishment. I know many nurses are able to do that and many are not, but I was pretty proud of myself for being able to do it within the 75 questions. So I'd say both of those things related to nursing have definitely been accomplishments thus far.
Nice. Yes, that's true. 75 questions. That means you studied well.
I'd like to think so, at least for a month, I'd say.
Yeah. Why would you like to work here?
Well, from what I've read about your practice and the variety of prescribers and providers that you utilize in your practice with physicians and nurse practitioners, it sounds like there's a great collaboration among team members. And so I feel like I'll be really supported in my role working at this practice with having other nurse practitioners as colleagues as well as physicians to oversee any challenging patients that I may occur. I was also really impressed when I read that there's continuing education support as well. So I appreciate your support in being able to further support my continuing education and helping me advance my knowledge in whatever area I feel like may need continued education.
Nice. What attributes do you have that will help you be successful in this position as an FMP?
Well, yeah. Well, as I mentioned, I am definitely a team player and I enjoy working with other people. And so I don't ever feel like I'm the only person in the clinic or the only provider that anyone can see. I definitely feel like there's always a collaborative effort amongst other providers that you work with. And so I would like to say that I am a team player, but also am supportive of my colleagues as well. And I'm always willing to help them with a challenging patient or willing to give them my opinion or expertise. So I would definitely say my team effort and encouraging of others is definitely something that I can provide. I also think that I'm willing to be a problem solver. And when difficult patients may come through the door and it's difficult to determine what's happening with them or what to do next in their care, I'm willing to put in the work and really figure out what the next best step should be. I've always been a hard worker my entire life, and I think that will continue to see me through until my last working days as a nurse practitioner.
Cool. Where would you like to be in 3 years from now?
I would definitely like to see myself established in this practice, of course, and having my full patient load and having a steady stream of patients that I see consistently. Perhaps I will have gone back to school to earn my doctoral degree, but we shall see. I'd like to get my feet under my belt and definitely feel established in this role first. But that's definitely something that I could see starting within the next 3 years.
Thanks. How do you think a friend, professor, supervisor who knows you would best describe you as a person?
I would say that they would probably say that they can always come to me for advice or a listening ear. I always feel like I'm willing to listen to others. Initially, for a while, I thought I would maybe go into psychiatry or psychology. So I always feel like I'm a good listener and willing to hear a full story about what's going on. So I think my friends would say that as well. I'm always willing to hear whatever side of the story they have to share. The same goes for patients as well. I'm willing to approach them with an unbiased opinion and hear the full story and hear what has led them in for their office visit or our interaction, and coming in with an open mind and willing to listen to them and try to get them feeling better.
Nice. And what type of work environment are you the most comfortable?
I would actually say that I'm pretty adaptable to any work environment. I feel like I've worked in a variety of different environments. I've worked in a hospital. I've worked on an incredibly busy floor in a hospital. I've also worked in an outpatient setting, whether it's been a busy surgical center or a private office, private clinic. So I really feel like I'm very adaptable in that sense. And so I find that I am pretty comfortable in any environment I can be in because I definitely adapt to what my work environment is. Definitely one where I know I'm supported by my peers, though. That's definitely something that I would say I need in any environment I work in.
Nice. Okay. I'm gonna resume now.
Okay. Hi, Richard. Thank you for joining me today. I'm looking forward to meeting you and introducing you to our environment here and for this role. Go ahead and tell me a little bit about yourself before we get started.
Well, I started my career back in 2006 as a nursing assistant. Then I got my RN license in 2008 after I finished nursing school. Then I did my bachelor's in science in nursing. Then I did my FMP at Chamberlain, and then I passed boards. And now I'm doing the Psych MP because with all the experience I have in Psych MP, every time I went to apply for a nurse practitioner job, they said, you have great experience in psych, but you don't have a psych license. And
Okay.
then, okay.
Okay, great. Well, so I guess tell me a little bit more about why you chose that career path then in mental health.
So like I stated before, most of the jobs I applied for as an FMP, most of the time, even now what I do, I work with the severe mental illness program for an insurance company as a case manager / RN. So basically every job I went to, they saw my resume and they said, you have a lot of psych experience. We would love to hire you as an FMP, but we need a psych MP, but you don't have the license. So basically, the Psych MP program was only a year with Regis, and that's why I'm doing the Psych MP program to hopefully land a job after this semester, which is my last semester as a Psych MP.
Oh, congratulations.
Thank you.
Okay. Well, speaking of school, what certain subjects in school did you like the best or did you like the least?
I was always good at science and English. Like I had honors English in high
Oh,
school, and science, I always had science when I was in 10th and 11th grade. I was doing science courses with the 12th graders. So I was always good at science.
okay.
Not that I'm bad at math, but I really don't like it. So that was one of the challenging subjects for me in school.
Okay, understandable. Well, why don't you tell me about what one of your greatest strengths is, or even maybe what a weakness is?
As far as strengths, I worked as an agency nurse for over 12, 13 years, basically doing local travel assignments. I've worked in every discipline in nursing, from ICU,
Wow,
ER, PACU, pre-op. And basically, my greatest strength is that I adapt to change well.
I
Weaknesses,
would say so.
yeah. Weaknesses, I would say that I'm very detail oriented. I'm very, very kind of like OCD. I like things done right and like very well done. If I say if you can't do it right, don't do it at all. That's my motto.
That's a good motto to have. I'm sure many nurses can relate to that. That's very understandable. All right. Well, what would you say are three accomplishments that have given you the most satisfaction or that you're the most proud about?
Probably when I passed my NCLEX, that was
Mhm.
one because I took it like two times. On the
Okay.
second try, I really studied and I passed. And then my second biggest accomplishment was passing the ARMP boards for family. That was a
Mhm.
big accomplishment too. That gave me a lot of satisfaction.
Yeah. Great. Yeah, that's a major accomplishment. You should be very proud. You've
Thank
already got one licensing exam under your belt. I'm sure that the mental health one will be no problem.
I'm
All
hoping.
right. Well, yeah, absolutely. Well, why don't you tell me a little bit about why you would like to work here or what interested you in this telehealth mental health position?
Well, the job that I do now, basically with working for the insurance company in the severe mental illness department, it's kind of like telehealth, but the only thing, we don't use cameras. We just call on the phone. And then before the pandemic, we would actually go out to the street and look for, because what we do is we find the highest utilizers of the insurance company with severe mental illness, and we try to engage them in rehabilitation programs for drugs, alcohol, any controlled substance that they have issues with. And we try to get them into programs, or we try to find providers in the community to get them to stop going to the hospital so often to save.
Wow, that's
Yeah,
great.
yeah.
Gosh, that's wonderful work.
Yeah, but now with the pandemic, we don't do field visits anymore. So everything
Okay.
pretty much is home based and it's like telehealth. The only thing, you don't
Mhm.
see the person's face.
Right. Gosh, that must be a very different change, huh?
Yes.
Um, yeah. Well, I guess where would you like to see yourself in 3 years from now then?
Hopefully 3 years from now, I would like to be established as a psych mental health nurse practitioner. And hopefully, I would love it if the state of Florida would grant autonomy like they did for the family, that you can
Mhm.
even open up your own practice. I would love someday to have my practice and see patients, in my own practice. That would be a big, that would be something that I would really love and looking forward to see how the laws change.
Yeah, hopefully Florida will go that route. I hope that they do for you. That would be wonderful.
Thank
What do you think one of your friends or professors or even a supervisor would say about you if they could describe you?
you. I'm quiet. I don't really
Mhm.
like to be in the gossip scene. I s-
Mhm.
I stay away from that. I mean, usually people that do travel nursing, they usually do it. The longest they do it is maybe 1 or 2 years before they get out. I actually did it for over 10 years, so I know how
Wow.
to get along with people, even if I don't know them, and I really don't try to like bother anybody. I try to do things right and do them
Mhm.
to the best of my knowledge without having to get in anybody's way.
Well, that's good. That's not a bad thing. I'm sure it makes you very likable wherever you go.
Yes.
Speaking of those different environments, I guess what environment do you feel like you work best in?
I think I work best in stressful environment. I think from working in corrections, nursing, taking care of state and local corrections, and working in like kind of like a jail setting, and also working so much with psych patients, I think I do well under stress. I think I do well.
Good. Well, gosh, do you have any questions for me at this time?
When do I start? I'm just
How about next week? Will that work?
yes.
All right. Well, we will get back to you as soon as we're able to. Thank you so much for this interview. It was a pleasure meeting you.
Thank you. Likewise.